Hi, we're doing something a little bit different here this year with our prescription drugs, and I want to talk to you about that. But before we do, I want to let you know that this AEP, this annual election period, it is not for Medicare supplement plans. The annual election period is just for those parts of Medicare whose benefits change every year. That includes your Medicare Advantage plan. That includes your prescription drug plans. Medicare supplement plans don't have an annual election period because you can change any time of year as long as you qualify medically. And of course, some states have special rules as well. So this AEP, which goes through December 7th, is the time period for you to take a look at your prescription drug plans, or if you're on a Medicare Advantage plan, to take a look and choose a Medicare Advantage plan. Now, this software can be used for both a Medicare Advantage plan and a prescription drug plan we're going to talk about in a second. But if you have a Medicare Advantage plan, I'm going to suggest you give us a call because we have some more advanced features that will include adding your doctors and as well as all of your prescriptions and very quickly identifying which plan is right for you. So what's going on for 2020? Well, first thing, in September of this year, September 1, Medicare changed their website. They changed website vendors, and in doing so, took away some of our ability to help you by these drug ID numbers that we had saved in previously so that we can pull up your prescription list. They've taken that away. They're now making you log on and to access your drugs and only access drugs if you've logged on. To make it easier, and actually it's, every change is certainly an opportunity. Well, with this change, we've come up with a better idea that I think is going to make it easier for you to manage your prescriptions and get into a plan I recommend. People are often asking, there are a lot of plans out there, but which ones do I know work well with people and which ones are good companies to be in? Well, in the link below, there's access to this page of mine. This is my page. It is called Medicare Insurance Direct, and it is there so that you can manage your Part D plan and choose and enroll in a new Part D plan for 2020. Now, if you've had an Aetna plan, which has been discontinued, or you had a Humana plan, which they've changed you into a more expensive plan, this is going to be an easier tool for you to fix your situation and get into a good company without having a whole lot of costs. So first thing to do here, what we've done is when you access this, it's only going to show you the prescription drug companies that I would recommend and that I work with. It doesn't show you all of them, just the ones that I am working with in this year. So a couple ways that you can do this. You can create an account on the bottom here. If you create an account, it's going to save your information so you can go back to it at a later time. Or you can go directly to the plans. If you want to just go direct, see which is the cheapest plan, that's one way to do it. Another easy way here, of course, is just to click the Get Started button. Now, when you click the Get Started button, it brings you to two different choices. If you want to put in your prescriptions, you click the Help Me Choose button. If you just want to go straight directly to the plans and then sort them by the lowest cost plan, you can do that right here through View All Plans. Let's take a quick look using prescriptions for just a moment. We're going to click Help Me Choose. And the first thing it's going to ask is that we put in our zip code. I've already done that there. There is also this section here. If you click just drug coverage, and that way it's only going to pull up the drug plans. That's what we're looking for. We're really not, in this case, looking at Medicare Advantage plans. If you have help from the state for your prescription drugs, you can click down here and select the right choice as well. So we're going to go ahead, since we've got our zip code in, we know what county we are, we're going to click Continue. It's going to ask you for your prescriptions, and I've already put in two prescriptions here, amlodipine and metformin, and all you would do for this is, if you choose a plan or choose a prescription, choose your dosage, your quantity, add that to your drug list, and as you pull up drugs, it's going to start to fill things in. And sometimes it does it a little bit aggressively. So actually, if you have a list of your prescriptions, if you have a lot of them and you've got them on a Word document or a text document, you can copy and paste and put them in, or you can I'm just kind of guessing on drugs here, but you can just go ahead and stick something in. We're going to pick a drug, an interesting one here. No idea what that is, but that's all right. So we've got our list of drugs, and you can say then, once you're done, you say my drug list is complete. Of course, if you want to edit them, you can as well. And the first thing it's going to do is pull up pharmacies. Now, you're going to have another opportunity to look at pharmacies a little bit better, but I suggest that to start with, understand that each of the prescription drug Part D plans has contracts with different pharmacies. So choosing a pharmacy is going to be just as important as choosing the right drug plan. To start with, if you typically would choose from the CVS, Walmart, and Walgreens area, you're choosing each of those, you're going to end up with some of the better plans. I've got CVS clicked here. You can choose the Walmart as well, and this will only allow you to choose one pharmacy at a time. But again, this is going to, we're going to have an opportunity to look at this a little closer here in just a second. So let's click Continue. Okay, so this will default to the prescription drug tab because we had chosen prescription drugs earlier. Please don't get caught in a Medicare Advantage plan tab or any of these other tabs. Make sure that you're in the prescription drug tab. And what this is going to do, this is going to list out the drugs. And the first thing we want to do is make sure if you have no prescriptions, you want to just sort it by the plan premium, which is what this is doing now. If you have prescriptions, you want to sort it by total estimated cost. Total estimated cost includes your monthly premium, includes a deductible if there is any, and includes your prescription drugs. So it is a total cost. We're going to put that in first. This comes up with the silver script. This is a total cost here, and that's what you want to be looking at. And then you've got a monthly premium here as well. And again, you can sort through here. You can see, for example, that some of these, or two of these here, are very close together. And this you may want to shop if you have a preference, or if it's a particular pharmacy you want to go to. And we'll look at that in a second. So if you have prescriptions and you've put them in here, make sure it's sorting by total estimated cost. If you're just looking for the lowest cost plan, sort by premium. Okay, so this says, in this case, Silver Script is the right plan. We've got a 4-star plan. It's a very well-liked plan. Mutual of Omaha, by the way, is good, but they just started last year in prescription drug plans. So they've been in Medicare since day one. Most of you know this is one of the the gorilla in the room when it comes to insurance companies, but they had just gotten into the Medicare prescription drug plan last year. So they may come up, there may be a star rating or partial star rating this year, but certainly by next year there will. We've got a lot of people in these plans, and so far we've got nothing but positive feedback. So let's take a look here. If you're saying, okay, well, that's Silver Script, that's your monthly premium, that's your total estimated cost for the year. But what about the drug details? Well, you come over here to where it says View Plan Details. We're going to click on that. And it's going to show you the plan details. Now, for example, the monthly premium here is $25.20. The plan itself is identified up here. So your premium, $25.20. Estimated drug costs, $12 per year. So only $1 a month for the drug costs there. It's going to, of course, show you your prescriptions, and it shows you a deductible. Now, I like the way that this lists out the deductible. It's much less confusing than it is on Medicare. Now, because on Medicare, they'll just say a $250 deductible. But on a lot of these plans, on most of these plans, that deductible only pertains to Tier 3, 4, and 5 drugs. So, as it shows, you have no deductible for Tiers 1 and 2, $250 deductible for Tiers 3, 4, and 5. And that's actually much less than I think the standard deductible this year, or Medicare's approved maximum deductible, is $435. And it goes into some more details you can look through here. The easy thing is, what we want to do is come back to the top and click on total or drug cost breakdown. And this is going to show us the breakdown of the prescriptions that we put in. And again, these are just prescriptions I pulled out of my head. They're very common. Shows you the retail cost that the prescription drug plan is paying itself, the cost to you before you hit a gap, the cost when you have a gap, and then if you go through it. Now, in order to have a gap, you're going to have a lot of money out of pocket here, and obviously paying $1 a month for your prescription isn't going to hit the gap for this particular case. Couple things to notice. You notice you've got a difference in price between retail cost and before the gap. Well, this shows you that these drugs are not that the deductible does not pertain to these drugs. If the deductible pertained to this drug, then, for example, this would be $1409 retail cost and then $1409, before the gap cost. We have here, in this case, these drugs have no cost except the $1 for the theophylline. You can also look at on a monthly basis, your cost for the drugs, or if you wanted to do a mail order, you can do the same. If there are quantity limits, they're going to note them here, or any other step therapy, etc. Those are, if you have any questions on these, just put your mouse cursor over the question mark, and it's going to tell you about it. So you can look at your entire 2020 year and what you're going to pay on a month-to-month basis. And if you have a lot of prescriptions or very expensive prescriptions, you may see, for example, when you go into the coverage gap, used to be called the donut hole, it's a little different now. And when you get out of it and go into catastrophic coverage. I mentioned that we'd have another opportunity to take a look at the pharmacies. That's an important part of all of this. You're going to choose, of course, one of the pharmacies to look at, but you also want to make sure that it is a preferred pharmacy. You will get your best prices at a preferred pharmacy, and that we find out right here. Notice in this case, with SilverScript, CVS is a preferred pharmacy. If it says standard, you want to find a preferred. This is very easy to do. Again, much easier than the Medicare.gov website. You simply click here on Search Pharmacy Directory. That brings up a window. We're going to go ahead and maximize it. It will list out the pharmacies in your location. Of course, it has the map as well as the directory here on the left. Note, though, that there's some that are in blue and some that are in green. Those that are in blue are standard pharmacies. Standard pharmacies are not where you're going to get your best price. And of course, there are preferred pharmacies as well. Those are the ones you're going to want to go to get your best price. There are a couple plans in here that have no preferred pharmacies. Everything is standard, but they're when you want to get a preferred pharmacy. So that's the easiest way to go about finding them. Again, you just come over here to click the Search Pharmacy Directory and look for the pharmacy that you want to use. To change pharmacies, you have to come all the way back. To change pharmacies, you have to come all the way back to, as you go from getting started to adding your drugs, to add a pharmacy. And, if you remember which of those pharmacies you wanted to add, you can add it in here and continue. So let's say that you've done all of this and you want to enroll in the plan. Great. Easy to do right here from this website. You simply click the Add to Cart button. And it's going to bring you can only have one prescription drug plan in the cart at a time. So then you just click Enroll. It's going to take you to a different site. In this case, it's going to take you to the enrollment portal for SilverScript. Whenever every company is a little bit different. We're going to show you Humana here in a second. But you've also get important information on the plans right here on the right-hand side, your summary of benefit, your various language efforts, star ratings, and other documents that you may wish to download and save. To enroll, this is extremely simple. You're going to fill out these forms, this form, and you're going to put in your Medicare information on the next page. You're going to choose how to pay for it, whether you want it to come out of your Social Security or a bank account. You put in that information, or direct bill, whatever the choices are. You make that choice, put that information in, and it's going to give you a chance to review it one time, make sure everything is correct. And then you submit it or enroll. You'll get a confirmation. I'll get a confirmation, and you're enrolled. Now, when you enroll in a 2020 plan, and you're during this annual election period, Medicare will transition you to your new plan on January 1. Medicare will cancel your old plan. You don't have to. And your new plan will start on January 1. In approximately 10 to 14 days from the time that you click that enroll button, you're going to get your information from the insurance company, including your new prescription card and any other documents that they need to provide you. So again, all you have to do is enroll. Medicare is going to take care of the rest. Choose the plan you want, click enroll. Medicare will take care of it. I'll be notified. I'll still be your agent of record, which means if you have issues, if you have problems, if you need to appeal, something goes wrong, call us. We're here to help. Let's take a quick look at your other way of getting to this point. And what we're going to do is we're going to go all the way back to the very beginning. And again, if you click Start Plans or Go Direct, I'm going to click Start Plans. We're going to do View All Plans, and this is a way to go directly to the plans without putting in any prescriptions. And in which case, if you're not putting in any prescriptions, you want to sort by plan premium. When you do that, you get the Humana plan that comes up. You've got Mutual of Omaha, etc., but $13.20. You want to add that to your cart. This is going to replace the SilverScript because you can only have one at a time. It goes to your cart. You click enroll. And now it's going to take you to, in this case, the Humana Enrollment Center, which would be directly from one of Humana's pages. Note that says it's a Humana page. Again, your benefits, the detailed information on the plan you can access right here. And again, all you have to do is fill in this form and click continue. And I think there's a second page in there. Time frame, this particular link right now is going to only have the January 1 start date. Then after January, you're able to have February and so on. But these are for 2020 plans, so you can't get them any earlier than 2020. And again, once you have enrolled in this plan, you choose how you want to pay, etc. And once you've enrolled, Medicare will disenroll you from the other plan and transition you to your new plan as of January 1. You don't have to do anything else, and you'll get your information and your card directly from the insurance company that you've chosen. So this is a very simple way to manage this. We'll be doing this each and every year. You're going to have the ability to very quickly find the plan you want. We're going to be adding some drug plans as well shortly, but not a lot more because of there's not a lot out there that is, there are a lot of small companies that we're not going to work with here. And but we want you to be able to find the drug plans that are going to be the best for you. Statistically, SilverScript's the most popular plan. Humana's the number 2 plan. Aetna was up there. That's being canceled, though. And in some states, there's the United Healthcare. United Healthcare is kind of a bug. It's showing up in every state, but I only work with it in Florida, California, and New York. So if you do enroll in United Healthcare outside of those states, I will not be your agent of record. It's a bug in this program. I doubt that it's going to be fixed prior to the end of this annual election period. So again, the annual election period is for your prescription drugs or a Medicare Advantage plan. If you have a Medicare Advantage plan, call us. We've got a new software that's much better than this that will help you to shop for your plan. For a prescription drug plan, just use this system. You'll enroll. We'll be notified. We'll know what's going on. You'll be able to take care of it very simply on your own time without having to set an appointment and all of that. If it's complicated, if you're having a hard time, then please call us and we'll help you out from there. So please click the link below. That's going to take you right to this page. And good luck, and call us if you need us.